I was virtually crippled. I could barely walk. I couldn't open a jar of pickles, in fact.
I crawled to the bathroom, I crawled to the couch, and literally just dragged my legs and walked on my elbows.
We've got great things that are happening for people who couldn't walk, people who couldn't move.
So there's a lot of new research, some new varieties of treatment we may be able to use.
It's like having a second chance. I'm just real glad to be able to do what I love to do and virtually go on without skipping a beat.
The most encouraging words that we can share from the Arthritis Foundation are to take control, and we can help. The Arthritis Foundation's goal in this next half hour is to provide updated and current information for people on new medications, on treatments for arthritis, osteoarthritis, rheumatoid arthritis, osteoporosis. There are over 100 kinds of arthritis, and that's sort of a little known fact. So our goal is to provide information for the viewer on what's out there.
I had a number of symptoms, primarily numbness in the morning in my hands and my fingers. I had some swelling and some inflammation and pain, but it wasn't all the time. It was intermittent. I played golf at the time, and I had to give that up. It hurt too much to swing the club.
There are two major categories of arthritis, inflammatory and degenerative. Inflammatory arthritis is a type of joint disease in which there tends to be pain, swelling, and stiffness, most notably in the morning, that can last for hours. And the two most common types of inflammatory arthritis are rheumatoid arthritis and psoriatic arthritis.
Well, rheumatoid arthritis primarily affects women between the ages of 20 and 50. However, it can affect children, newborn children. It can affect adults in their 80 years old. It also affects men as well.
Rheumatoid arthritis hit me like overnight. Went from doing just about anything I wanted to do, almost to a point where I could not handle a saucer, a cup, pencil, or a hammer with my hands. And then it progressively went from my fingers to my wrist, to my knees and my ankles.
We now know that inflammatory arthritis, like psoriatic arthritis and rheumatoid arthritis, can cause damage very early and very quickly. So we tend to treat these with more powerful agents earlier in an attempt to try and prevent joint damage and loss of function.
Early detection is probably the most important aspect, in my opinion. Many drugs, I think, can be very helpful in the treatment of rheumatoid arthritis if they're initiated early. Early detection and initiation of what we call aggressive treatment is the patient's best chance of slowing the disease process down.
We started off with lots of tests and started off with medicines, methotrexate to begin with, and after a couple of years we switched to Enbrel once it came out and was proven to work real good, and it's just been a miracle. It's been wonderful.
And this is one of a new class of drugs that are biologic agents that inhibit one of the pathways of inflammation.
I call it my miracle drug. I don't know what I did before it. I guess once I regained many of the functions that I had limited myself to because of the arthritis, it was like I was like a new person.
I was able to start moving again and walking and just doing normal things without screaming in pain.
I went from not being able to close my fist when I got up in the morning to actually just literally, the pain was gone, the swelling was gone. I could close, make fists, I could dance, I could do anything I wanted.
We're unlocking some of the secrets of the disease process, of the autoimmune process. Some of the new technologies that are now available have allowed us to develop therapies which are relatively safe and much easier to take than in the past.
The improvements have been swift and they've been remarkable. 10 years ago, when we began studying some of the more basic aspects of joint inflammation in the laboratory, the description of the molecules which drove this process was quite simple. With the advent of modern molecular biologic techniques and cell culture and immunology, we now have a much greater understanding of the underlying mechanisms that drive joint inflammation. The fact that blocking this one molecule can have a dramatic improvement in a patient's well-being is very rewarding professionally and very exciting, because now we have a greater understanding of mechanisms and can develop newer agents to actually block some of these other molecules which we know are important in the disease process as well.
These newer therapies have also greatly enhanced patients' quality of life. It's allowed patients to maintain gainful employment, to participate in a lot of the activities of their daily living that they had difficulty with before.
Last night, for the first time, I jogged. I went to a soccer clinic. I'm a soccer coach for my daughter's team, and I was able to kick the ball around. I was able to jog around, do some exercises, and again, I couldn't do that 6 months ago.
I'm able to actually hold a hammer. I can get on the dance floor, hold my wife without falling down. Basically, I can do anything anyone else can do that doesn't have RA.
There's new advances being made all the time, and my doctor is just wonderful. He's up on all the new stuff and takes really good care of me. So don't sit in agony. There's help.
The field has progressed so dramatically over the past several years that there are now agents available that can have a significant impact not only on the way that you feel, but on preserving joint and bone integrity and function. And so therefore, the importance of early diagnosis and therapies with practitioners who are very familiar with biologic agents and methotrexate, I think is vital to maintaining your health and well-being.
When you think you have rheumatoid arthritis, even if you don't know you do, get medical advice. There are drugs on the market today that actually will turn it around overnight for you. There's no need for suffering the 10 years that I suffered. With the Enbrel, it was a miracle drug to me. And anyone that's afflicted with RA, they really need to get medical attention immediately, because there's ways to treat it today without people having to suffer all that time.
In layman's terms, osteoarthritis is the wear and tear of joint surfaces, much the way your tires wear out after you've driven 40 or 50,000 miles. Now we know that a bad injury to the hip or knee that involves a fracture and injury to the joint surface will lead to arthritis, no question about that. But by and large, degenerative arthritis is a hereditary problem.
I was having significant pain. I was really having problems walking, going up steps and going down them. And to stand still was excruciating. To stand and do dishes was not even thought of anymore. And it just seemed to be getting worse and worse.
Joan has a very common problem, osteoarthritis of the knees. And osteoarthritis advances. Her arthritis was still in a relatively early stage, so it was only affecting part of the knee. When the arthritis is early and only affecting part of the knee and not the entire joint, we have more treatment options available.
This is a form of arthritis which is most common in patients over the age of 50 and can be the source of severe pain and disability, especially if it affects the knees or the hips.
The most common symptoms that patients will notice when they start to have knee arthritis of a significant amount is pain with walking and weight bearing. Oftentimes they'll notice a bowing to their leg, as the inside part of the knee is most often affected.
I was not doing grocery shopping. My husband had to do that. I was not going anyplace. I'd ride in the car and stay in the car. We even bought a van instead of a car because it was hard to get in and out of a car where a van sits up a little bit higher. We like to camp, and I was having a hard time doing that. You know, we would go, but I would sit in the chair while everybody else walked the beach.
Or in orthopedic surgery, we have a number of non-surgical and surgical ways of managing osteoarthritis to reduce the pain and prolong the wear of the joint, even though it's beginning to wear out. Not unlike the same way that we save our tires by rotating them or realigning the front end so that the wear in the tire is not as rapid.
There are now medications that may actually have an impact on the progression of osteoarthritis, and these are available over the counter. Glucosamine chondroitin sulfate is a medication which has been available for several years now, and studies are starting to come out that demonstrate the effectiveness of these compounds in some patients with osteoarthritis.
But oftentimes there are side effects associated with first-line nonsteroidals like Motrin or Aleve or Advil. For those patients that have sensitivities to those medications, there now is another medication available, a more specific anti-inflammatory, and of which Vioxx is a type. Patients that can't tolerate regular nonsteroidals often will tolerate a more specific nonsteroidal such as Vioxx. However, you do need a prescription to be on that therapy.
Now we have a wide array of anti-inflammatory drugs, and just recently we have anti-inflammatory drugs that are much easier on the stomach than the ones prior to that. And finally, we've replaced joints, whether it be the shoulder or the knee or the ankle or the hip. We can put artificial surfaces on these joints, leaving the nerves and blood vessels and muscles so that the patient can walk without pain.
A total knee replacement requires about a 10-inch incision and usually about a 3-day hospital stay. The partial knee replacement can be done through a 3-inch incision and can be done on an outpatient basis. And that technique was really pioneered by Dr. John Rapisi, who is a native Buffalonian.
Joan's problem is very common in that she's a younger patient, and a total knee replacement would be an option for her, but she's really too young for a total knee replacement. Most surgeons don't want to do a total knee replacement before age 60 or 65.
Partial knee replacements last about 10 years, and then when they have outlived their usefulness, they can be converted to a total knee replacement quite easily. The procedure takes about an hour, and then 2 or 3 hours later, Joan was able to get up and start walking, and she went home later that day.
Just being able to get around. I do stand at the sink and do dishes. I can stand and talk to people now, which I couldn't do. I'd always look for the chair or someplace to sit down because, you know, the pain to stand still was really bad. It certainly has changed my life. I would recommend it to anybody.
The future is even brighter because of the biochemical approach to osteoarthritis, which I think we will see in the coming years, continuing reduction of the need for joint replacement.
So this is also very exciting, and I think we're going to see major developments in osteoarthritis which parallel the kinds of advances we've seen in rheumatoid arthritis and psoriatic arthritis in the near future.
I have osteoporosis and arthritis. And the osteoporosis, I believe, is in my back. And I suffered 5 fractures, 2 thoracic and 3 lumbar. And it started with a lumbar fracture first, and then as the doctor explained it to me, that it was just like a domino effect.
Osteoporosis is a silent disease, a symptomless disease, where our bones lose density or bone mass to the point where they become fragile and susceptible to fractures. It's a disease that affects mainly women, but we find many men, approximately 10% or so of the population of men have osteoporosis.
There are certain risk factors for individuals who might be more likely to have osteoporosis. Those risks include people who are thin, individuals who may be on certain medications like corticosteroid medications. If there is a family history of osteoporosis, if a woman knows that her mother has osteoporosis, has fallen and broken a hip, or is there evidence of spinal fractures in any of her close family members, that then puts her more at risk for having osteoporosis herself.
I met Mrs. Brown a year ago when she was referred for management of rheumatoid arthritis. She is now on a couple of medications to control it, but she's doing well.
I probably had arthritis for a much longer period of time than I realized. Seniors often are quite used to having little aches and pains and don't pay too much attention if they don't last too long. But when they started lasting really long, I went to a doctor.
Because of a family history of osteoporosis, we did a screening test, a DEXA scan, and found osteoporosis.
DEXA is spelled D-E-X-A, and it is a new technique that is virtually now the gold standard for the diagnosis of osteoporosis. It's a very simple and quick test that allows your physician to measure the density of bones at virtually any site in your body. Knowing this information, we can predict whether or not you will be at risk for fracture at any of these sites.
So we certainly have things available to us that we didn't in previous years, and I think we can do much better as far as addressing people's needs to treat their osteoporosis.
I was willing to try anything because I've always been very active. I play golf. I was in 2 bowling leagues, 2 golf leagues, and I lived in Florida for 15 years and was always at the beach or walking, and my husband and I used to walk daily. So when I was suddenly cut off from all of these things, it was kind of a blow.
When you're in pretty good shape, you can do things, and when you're not in very good shape, you can't. And so you have to kind of go with the flow. The medication does make a difference. It does.
There are a number of medications now on the market approved by the FDA for the treatment of osteoporosis, and they fall into 3 main categories. They are the estrogens or estrogenic-like compounds, the category of drugs known as bisphosphonates, of which Actonel and Fosamax are 2 examples, and the naturally occurring hormone called calcitonin, the nasal spray medication known as miacalcin.
There are a number of different things you can do for osteoporosis. Taking calcium and vitamin D are sort of like building blocks. After about age 30 or 35, the body does not do a very good job using these building blocks to make bone. Medicines like Fosamax can help improve the body's ability to build bone.
And since coming to Dr. Pryhuber, I am now on another medication, Fosamax, which is hopefully going to be helping me a lot more.
A woman's maximum bone building phase of her life is between her late teens and her late 20s. So when a woman is in that phase, it's extremely important that she consumes enough calcium.
Dairy products have the highest content of calcium compared to any other foods. If, however, it's not possible for you to take in the appropriate amount of calcium with dairy products, calcium supplementation is very appropriate. We now know that there's calcium supplements in orange juice, calcium supplements in bread, and there are plenty of calcium supplements on the market that are very effective for increasing our calcium intake.
One thing is you must stay as active as you possibly can. If you don't feel like doing something, do it anyhow. That's all.
Exercise is very important. Exercise helps strengthen muscles and reduce risk of falling. Exercise also stimulates bone growth.
If an individual could lift weights, even light weights, that puts more stress on the bones and is most helpful. But even things like walking or running, any kind of good physical activity, other than perhaps swimming, which is not considered weight-bearing, is going to be helpful for building and maintaining good, strong bones.
If I could give any advice to anybody, the way things are with me and today, I would make sure that my daughter and all young people of my daughter's age become very aware and very serious about getting themselves checked physically to see what condition they are in and what the possibilities are for them to have the same kinds of things happening to them that have happened to their parents too.
Oftentimes women don't think about osteoporosis or think that they're at risk for osteoporosis and don't get screened properly. It's something that they should talk to their doctors about to get the proper screening to see if they actually have this disease or not.
Treatments for osteoporosis have gone through a wide range of research over the last decade or so. All the current therapies approved by the FDA now treat osteoporosis by blocking or inhibiting the bone loss that we have in our skeleton. And although these drugs are indeed effective and can prevent fractures, they are only part of the answer. Here in Rochester, we are trying to devise new therapies that will actually stimulate new bone formation. These types of therapies, we can take women or men who have lost a substantial amount of bone in their skeleton and hopefully increase that skeletal mass to the point where they are no longer at risk for fracture. I hope in the next 5 years to be able to tell you that we've made significant advances in both the diagnosis and the treatment of this disease. And I'm feeling pretty confident that with time we are going to eventually cure this disease and eliminate this from our aging population.
They're working on new drugs all the time. And what would help me may not help you, but would help someone else. I'm anxious to get back bowling. I don't know whether I can or not, but yeah, I keep asking the doctor.
The Arthritis Foundation has a whole host of different information pieces and programs for people with arthritis and related diseases. We provide information and referral. We take about 35 to 50 calls a week from people who are just looking for a brochure on a specific kind of arthritis, understanding of what programs we have available.
Support groups in which patients have the opportunity to interact with other people who have similar sensations and feelings, and people find that to be often uplifting and a real source of knowledge and a resource.
The Arthritis Foundation also helps to support exercise programs, water-size programs for people with all kinds of arthritis. And I found it to be a very helpful resource in my practice.
So certainly people can call us at our office. In Rochester, that's 264-1480, and in Buffalo, it's 626-0333. Our website is a really great source of information. That's www.arthritis.org. And just walking in, both cities we have offices, so we welcome people to come in.
The Arthritis Foundation is my strongest ally in educating my patients. The more my patients know about their disease and the more my patients know about how to manage it, the healthier they stay and the better they are as consumers.
The mission of the Arthritis Foundation is to improve lives through leadership in the prevention, control, and cure of arthritis and related diseases. And we're here to do that in providing programs and services, educational seminars, information, referral to specialists, and anything else that we can do to help people as they face the challenge of living with a chronic illness.
The breadth of topics covered beyond osteoarthritis to many other arthritides that are covered by the Arthritis Foundation provides people with support and understanding, and it does away with the sense of lonesomeness that so many people have when they think that they're the only ones with the problem.
Seeing somebody who 3-4 months ago was on crutches and couldn't walk, degenerative osteoarthritis, who is walking now without crutches, without a cane, ballroom dancers who couldn't dance yesterday and are able to do so today. Talking to people who've had the disease before is a great way to find out what you might be able to do to help you as you start a new challenge in your life.
There's hope. There are a lot of things out there that can help you. It might take time to find the thing for you, but there is hope that you can do whatever you want to do with your life, not to be restricted, and they're making improvements every day.
Well, there are a lot of times you'd like to stay in bed and not get up, pull the blankets up over your head, but get up, get on your feet, get going. And if it's a gloomy day, put on your hat and go down to the store.
The fact that I am no longer having this swelling and the pain in my hands is due directly to the medications that I'm taking. I know that, and I'm glad to have that, because in the past there wasn't that kind of medication offered, and I can't imagine how people lived with that pain.
It's not going to go away, but we got it under control.
We handle it together. Together with my family, extended family, and which I consider Dr. Richland. We have worked through this, and I definitely, I feel great, and I want to share that with other people.